Hello, thank you for joining Code Rhetoric with Tam Talk. In this segment, we will be focusing on ICD-10 guideline stating documentation for BMI, depth of non-pressure ulcers, pressure ulcer stages, coma scale, and NIH stroke scale. This guideline can be located in your ICD-10 coding manual under section I, letter B, number 14. The documentation for BMI, depth of non-pressure, as well as pressure ulcer stages, coma scale, and NIH stroke scale guideline states for the body mass index, also known as your BMI, the depth of a non-pressure chronic ulcer or pressure ulcer stage, the coma scale, and NIH stroke scale codes. Code assignment may be based on medical record documentation from clinicians who are not the patient's provider. Examples are physicians or other qualified healthcare practitioners that are legally accountable for establishing the patient's diagnosis. Since this information is typically documented by other clinicians involved in the care of the patient, such as a dietitian, or often documents the BMI, a nurse, often documents the pressure ulcer stage, and an emergency medical technician often documents the coma scale. However, the associated diagnoses such as overweight, obesity, acute stroke, or pressure ulcer must be documented by the patient's provider. If there is any conflict in medical record documentation, either from the same clinician or different clinicians, the patient's attending provider should be queried for clarification. The guideline also states that the BMI, the coma scale, and NIHSS codes should only be reported as secondary diagnoses. In other words, these codes should not be listed as primary diagnoses for the patient's encounter. So our coding tips for this segment is number 1, to always pay close attention to the provider as well as his or her documentation to ensure the appropriate credit is given, as well as to make sure the correct code is assigned. Number 2, remember to code to the highest specificity. And lastly, when in doubt, always reference your coding guidelines or query the healthcare provider. Thank you for joining us as we discuss Medical Coding 101, referencing the ICD-10 coding guidelines. To learn more, please subscribe to our YouTube channel entitled Abraham Medical Coding Coach Abraham, or visit our website at www.abrahammedicalcodingcoachllc.com. And also take a look at our coding blog, which is entitled What's the 411 with Coding? To get in contact, please email us at abrahammedicalcodingcoach@gmail.com. And again, thank you.